Hi, this is...
Hello.
Hello.
Hello. Dr. Gill, do you want to kind of start, or?
Oh, why don't you introduce everybody today, Pamela? From Pulsar Health.
Throw that out there. Okay, I'm Pamela Giustizia with Muse MediSpa in downtown Boca, and we have Dr. Gill, our medical director, who has a plastic surgery center in Palm Beach. He specializes in cranial facial and breast augmentation, although yesterday we were calling it a little something different. And then I have with us today Michelle Ruse and Paul
Close. Kohlmeyer.
Okay, I like Paul. Hey, I'm Giustizia. People never get that right either.
No
And
doubt.
we're going to talk about cupping, which is something I don't know much about. Holly is with us here, and Holly is a good friend and has been super helpful with hooking us up with a lot of different connections, such as you guys, with nutrition, with wellness, with fitness, personal trainer. She's like pretty much everything. And she works here at our salon as well. So she's like multi-talented and faceted. But that's how I got connected with you guys. Do you want to share something, Holly, about your experience with them? And
well, I mean, I think they're amazing. I've been cupped by Michelle. She massaged me, and she's just the best I've ever experienced.
And they're located they're located in Canada, but also right between Dr. Gill is practice and our practice. So in between, basically, Palm Beach and Boca, which is super awesome.
I gotta go.
You gotta go. She's got a client, but you can tell
See you
me
later.
if I want to pop in, bring a chair.
Do you guys want to tell us a little bit about cupping?
Sure, we can do that.
Or about yourselves, how you got into cupping. Like, how does one get into cupping?
Oh, that's a bigger story. So let's start there. Okay, for me, I am dual certified. I do traditional Chinese medicine, so acupuncture, herbal medicine, and all of that entails, so cupping is included there. So in my training, we took cupping as part and parcel of our education. Before that, and since that, I'm also a massage therapist. And as a massage therapist, we use it as a style of soft tissue manipulation. English is hard today. So when you are doing different forms of instrument-assisted soft tissue mobilization, this is one of the tools you can use. So cupping really, and I'll let Michelle talk a little bit after me, but I'll tell you a little bit more about cupping. Cupping is the use of an instrument that so happens to be in the shape of a cup. That's why it's called cupping in English. And it's the use of that cup to mobilize or manipulate soft tissue. So doing some sort of treatment modality. Michelle?
I've been a massage therapist in South Florida for over 20 years. I'm really well connected in the massage industry. I've attended probably 200 or more trade shows. I used to work as a sales rep, and I have a lot of good connections. So the more cupping started becoming more well known to the public is kind of how I started getting involved. But I was doing it before that. I started doing cupping more once the Michael Phelps got seen with the marks. So I do mobile massage, and I come to your house and have been doing cupping for 10 or more years. To me, it makes my job easier, and I can multitask because I can place cups in one area while I'm massaging another area. So I feel like I can accomplish a lot more doing cupping.
Can you tell us a little bit more about the Michael Phelps story?
Oh, sure. Why don't you go?
Well, he was training for the Olympics, I believe, and he had cut marks all over his body, and people kept asking what those marks were. And then that's kind of when the cupping craze hit, because they knew that they were cupping marks. And from there, it just kind of blew up. And that's really when we started our cupping business, was right around that time.
So what kind of clients do you use cupping on? Like, obviously he's an athlete. What kind of people do you use cupping on?
For me, I do a lot of backstage work and work with professional athletes. So I am in with athletes, but I do also cup children. I do pediatric massage. Your everyday average person can enjoy cupping too. It's very relaxing, especially if you're doing it on the traps or on the face. We have cups where you can do facial cupping that can help reduce fine lines and wrinkles. So it really just depends. For me, if someone has an issue that is stubborn and will not go anywhere or change just through massage, that's when I will introduce cupping to them into the treatment.
You know, it's interesting, if you don't mind me adding this in there, because we were, one of our topics, was it last week, Dr. Gill, on Tuesday with Joseph, and we were talking about the blood circulation to the scalp and how that can help with hair growth and just keeping, you know, like brushing and keeping the blood circulation going there. So is that kind of the foundational thing behind cupping, is to really pull the blood into a certain area to help and promote healing? And
Yeah, we think so. Now, I say we think so because there really hasn't been a lot of histological research about what happens when you put a cup in the area. So there's more observational hypothesis around it. So you put a cup on a piece of the skin and you certainly see blood brought to the area. The capillary beds are fairly low pressure. So the areas around the skin have very low pressure. You put a negative pressure or suction on that cup or on the skin because of that cup, it draws a lot of fluid and blood to that area. So you get a lot of redness. So certainly there is an increase in local blood circulation. We certainly don't see it as a systemic change unless you're doing a lot of cups.
right,
But certainly locally it works. And a lot of the hypothesis around physiologically why there's change in tissue after cupping is because of the increased amount of oxygen in the area.
Hi, Veronica.
Veronica just joined us, and I know you are like a real fan of cupping, right? So we've been learning a little bit here about
Yeah, I wanted to say the one time I got a lot of cupping was when I first moved to Arkansas, and I had a lot of trouble with a respiratory infection. I had it for like months. I was like, oh my God, am I going to die? What's going on? And so the chest x-ray didn't find anything. And
Right.
And then so I went to this acupuncturist, and she started doing all these things on me, including like she would be cupping the back of my chest all the time. And
Sure.
eventually it took me like 4 or 5 months, I finally stopped having this like weird cough. But I don't, and I think,
and it wasn't COVID.
it was pre-COVID. But I was like, how does that work? Like with the whole, and then next week we do have our acupuncturist on, Christy, who I'll also question about that. But from the cupping viewpoint, how does, like, that was to treat lungs. Like, how does that work?
That's an interesting question. So there's the Chinese medicine explanation, which I'll leave for your acupuncturist. Being an acupuncturist myself, I know what how I would relate those two.
I like different opinions. Give us your opinion too.
Okay, well, I'll come along for that ride.
Yay!
So in Chinese medicine, there's the concept of qi, blood, and body fluids that are supposed to circulate through your body at all times. Okay, when you have something like a cough or congestion or pain, those are signs that one of those three things or more, it could be 2 or 3 of them, are not circulating properly. Okay, so if we want to get rid of a cough, which we call rebellious qi, it's going the wrong way at the wrong time, or if we are dealing with congestion where there's an accumulation of yin, which is fluids, in an area, those two things can create this idea of stagnation or congestion in the area. What cupping can do, one of the theoretical precepts is that if you apply cupping, it moves blood and qi and body fluids. Mm-hmm. So if you are inherently have a congestion or a stagnation of that, or they're not flowing appropriately, if you can apply cupping, it will, they call it smooth the flow. Okay, so
go figure. I never knew I had rebellious qi. Now I know.
Yeah, well, you did.
Thank God it wasn't rebellious cheese, because that would be
right. That's a different thing altogether.
That's a totally different situation.
Yeah. It's funny you say that. I call it cheese because I'm very Western medicine in my approach to talking to my patients. So I often refer to it as cheese, just to get their brains off of the Chinese medicine ideas of things they've heard.
Right. And I have heard, now, how do you determine, I know, see, we're going off the questions that you guys
Yep,
gave us,
that's
because
fine.
this is just, we're going with the flow,
Yes,
right? Okay.
I'm in.
So
Rebellious cheating.
I
Yes.
am a rebellious cheese.
Yes.
So, no, really, I follow all the laws all the time, all the rules. How do you determine when a client or patient or whatever you want to call them comes in, where would be the ideal location for you to do cupping versus acupuncture versus massage?
Part of that is going to be driven by what the patient is asking. Okay, so if the patient comes in asking for a cupping treatment, they're going to get a cupping treatment.
Mm-hmm.
If they're coming in for acupuncture, generally they're going to come in for and get acupuncture. And if they're coming in for a massage, they're generally going to get a massage. Where we find because they all work together, if the patient plateaus in their treatment plan, we expect a result when we apply X treatment. And if we do not get that result, we will say, hey, maybe we can add this, or maybe we can add that, and move towards the next thing. So it depends on how they come in. Normally for us at my clinic, cupping is the thing we add in. So people come in for acupuncture, people come in for massage. Okay. They don't often come in specifically for cupping, though we're seeing more and more of that. But so they've come in for massage, and we do massage a few times, and we're just either not getting the results we want, as Michelle said, or they've reached a plateau and we need something to push them over that edge. Cupping is a really easy thing to add into either acupuncture or massage treatment.
So why would I come in for cupping? Like if I was like Joe whatever, Joe Doe on the street.
Jojo.
Jojo.
Or John Doe. I think is his real name.
No John Does.
So what would I be thinking? Like, why would I want, like for massage, I would be thinking, oh, like my muscles like are really tense. For acupuncture, it's like I don't feel well, something's wrong. What would be the thing that would be like, oh, I need to go get cupping? So what would make you think of that? Michelle, do you have any, like, what would you recommend?
Well, I mean, if you don't know about it, I wouldn't think you would say, I want to try it. And if you see the marks, they can also make you not want to try it. So, you know, to me, if you're someone that if you just came to me and you said, I have these tension headaches, they will not go away, I've tried massage, I've tried everything, then that's usually when I will say to try the cupping. But for someone who's never done it, like for me, I do get a lot of people that have never done it and they just want to try it. So if they don't have any specific conditions, I usually say, well, if you get a massage, what areas do you normally like to be treated? And almost everyone is neck and shoulders. So that's what I would start with, and what most people probably would start with. And there's different ways that you can do cupping to where you won't leave a mark. You can be more aggressive or not. It just depends. I tend to be more aggressive, but on the first times I
like, we're going to do this. Slowly. Let's do it, right?
Well, yeah. I mean, I work with a lot of professional athletes and bodybuilders right. and that compete, and they are used to being in pain all the time. And that's what they want. They want the aggressive type of cupping. You know, some of my clients, I'll put 25 cups on their back and then I move their arms around or cover their quads, make them get off the table and do squats. So a lot of times my clients, the athletic ones, they'll stay dressed because I make them do exercise with the cups on, which can create an effect a little bit quicker. But I have several women who see me more on the aesthetic side because it can help, you know, temporarily plump fine lines, wrinkles, cellulite.
And you
like
don't,
that.
do you get with on the aesthetic side of things, do you get the bruising and the typical things that we see when you?
Not generally, because you're keeping the cup gliding most of the time. You'll get the marking when you leave the cup stationary. So usually, like if I'm treating my face, I can put the cup on and just.
And you guys do it different when we were talking originally about, you know, whether or not you guys were going to participate in this or not. You guys do a different. You don't use, like, normally it's like a flame underneath or something of how you do it, and you guys do not use the flame. You have a different.
Well, and most people, if they've heard about cupping or had cupping, that is usually how they're introduced to cupping, is from an acupuncturist and fire cupping, and that can tend to be more aggressive, in my opinion, because normally they're putting the cup on the person and leaving it on for 15, 20, 30 minutes, which will create those really dark marks that can turn people off. So when we teach the courses, he does demo it to show, you know, this is what you're probably used to or what you may have seen.
Or what your patients are going to tell you.
Yes. And he does that cupping because he's an acupuncturist. I'm not sure in Florida if we can use fire. To me, it's more risks. You can burn someone, break the cup. I'm mobile. I don't need.
I always think it looks like you got a bunch of hickeys all over your body. I'm like, what were they up to?
The cupping marks, you know, those bruises that you have after cupping, you can get those from no matter what kind of cups. It doesn't matter the kind of cups you use or the application of whether you use fire cupping or use some sort of manual cupping where you have just deform the cup and put it on, or if you have there are some like machines out there that look like aquarium pumps that just pump the air out, right? And either any which way you do that, you can get cupping marks or bruises. However, it's up to your therapist to apply it in such a way that it works for you. So if we're doing a lymphatic drainage style treatment or doing an aesthetics treatment, well, bruising is the opposite of what we're trying to accomplish. We don't want to break blood vessels, which puts more fluid in the area and or is visually unappealing, right? So with those kinds of styles, you're going to apply things like gliding cupping, like Michelle was doing, or flash or fast cupping, which is a style where you put the cups on and take them off right away, but do it over and over and over again. So there's never this overwhelming amount of blood in the capillary bed that can start breaking the blood vessels.
So you guys sell the cups for people to actually purchase, and how do they learn how to use the cups that you sell? Like, are they courses, or how do you instruct them? How does it work?
Sure. So we tend to teach manual therapists, so acupuncturists, chiropractors, physiotherapists, whoever, massage therapists, who have their some sort of licensure or some sort of training already. So that's how we normally go about it. And we have them take a set of courses. Those courses all totaled are about 20 hours worth of education. And that's usually good enough to have on top of whatever medical training you already have to add it into your practice. For the most part, we had been doing that live until this whole coronavirus thing. So the party moved to online now. So we have Zoom trainings. So it's kind of
the new normal.
Yeah, the new normal, absolutely.
And for the public, we on our Facebook page, we've been doing some 1 hour every Monday at 2 p.m. Eastern Standard Time. Paul goes live and he does some cupping for self-care or just quick treatments to show the public and people that are interested how to use the cups. A lot of people that go through our training, they will then teach their clients how they can do self-cupping at home. So we've kind of been moving more towards that since everyone's stuck at home. He's been doing a lot of Facebook Live videos to show people how to use them.
I just wanted to real quick introduce Tony. She's my right hand certified medical assistant and basically does everything right.
Awesome.
Hi. So these two have been talking about cupping all day. They're so excited about it. I know you had a question.
Yeah.
But I'm educate me on it. I don't even know. So
I don't know if I missed it, but I was wondering if you could explain a little bit about cupping on the digestive system, the stomach area.
Sure. So digestive again, if we go from the Chinese medicine standpoint, anytime you have any digestive upsets, I mean, there's making something really difficult simple. It all comes down to, is qi flowing properly? Or is it going the wrong way? So if you're burping a lot or whatever, that's air that's supposed to be going the other way. So that's rebellious qi. It's going the wrong direction at the wrong time, right? Or if you're vomiting, that same idea. If you have accumulation of qi, you'll have pain. So anytime you eat, you hurt. That's that kind of idea. Now there's more to it. You can have many other things stagnate. And that's why
it's way under talked about or underrated, and I think it would be so huge and beneficial to people that understand it.
Absolutely. So we use it quite a bit, and in fact, probably the best time or the best space in the digestive world that we use cupping is actually on pediatrics.
Yeah.
Pediatric digestive. As an acupuncturist, I actually don't treat children. They're not
It was
my
done on
skill
my
set.
daughter.
Right. So I refer to another acupuncturist that I went to school with, who her whole practice is pediatrics. And it is the best thing. If you want to make a mom's day happy, I refer them over. She teaches them how to do pediatric cupping, and they don't have the problem anymore. Like, just a little bit of management, because it's management, it's digestion, so it has to be managed, right?
A lot of people have digestive issues that they don't want to talk about, and I feel that this, along with meditation and, you know, mindset and, you know, yoga, but
dietary
this is for
change.
people who have terrible GI system problems, along with diet and nutrition.
Diet, nutrition, and gut health. Like those are the things we talk about on the community Mondays
But
and
this is
things
a
like
very
that.
big
But
component that I really think is not talked about enough.
I absolutely agree with you. Cupping for digestive problems is such a big thing in Chinese medicine. Now, your Chinese medicine practitioners, most of them will default to, number one is always diet. Number two is going to, in North America, is going to be acupuncture. Number three is going to be herbs. And only after that do you get someone who will do cupping for you.
I don't think that that's good, though.
Well, so what we do for in our clinic is teach our people to do cupping on themselves, because it's really, if you can do this more often, not all the time, obviously, and not after every meal, but if you can do it more often, a few times a week, then that's upkeep that I don't have to do as a practitioner. That allows me to see other people who are in more dire straits.
Yeah.
Because the management of digestive health has to be something you give to your patient. You have to give to your client that power. You know, here.
I think we were talking, might have been yesterday, Dr. Gill, about, was yesterday the day we were like all talking about all kinds of crazy things? Not crazy things, but we had a lot of fun with a bunch of different topics. And it really boils down to, like, maintaining health is so much easier than repairing health, you know?
Oh, yeah.
So when we get our, like, 20-year-olds who want to get their Botox done, or, you know, whatever it is, it's not because they think they are whatever. They're trying to maintain so they don't have to go in and repair. And so if we can maintain a healthy gut, and we can maintain healthy skin, and we can maintain, you know, healthy cardiovascular and all those things, rather than having to go in and really start with a ton of medications, and one thing compounds upon another, and
Sure.
before you know it.
Could you show us, like, how you do cupping? Like, do you have some cups there? You can just show us, like, a little bit.
Sure.
Will be fun.
I'm going to have Michelle stand up so that I can show you on her arm here. So she was already doing a little bit, so you can see the rings. That's just the edge of the cup. She doesn't have any marks on her. And I'm going to pivot you so you can see that a little better. Perfect. So doing cupping is as simple as just putting the cups on. Okay. It's not rocket science. This is, in a lot of cases, I always laugh. The first time I learned this, I went to show my dad, and he says, "Oh, I've seen that before." I said, "Oh yeah?" He says, "So my great grandmother did it to him for a chest infection when he was a child."
Wow.
And they are not Chinese. You know, they're German. Like, this is not a Chinese medicine thing, right? Most of Western Europe has been using this. Most of Russia has been using this. India has a history of it. Greece has a history of it. In Africa, some of the earliest pictures of tribal Africa have pictures of people getting cupping done. Like, it's not Chinese medicine necessarily. But so cupping can be one cup. It can be a number of cups.
So what would be, why do people use the flame then if you don't need to?
Well,
or if you just bring more heat?
Because it's theatrical.
Yeah.
Oh,
you've heard the idea that if you can have a good placebo effect, have the damn placebo effect, you can.
Mm-hmm.
If you add to the theatrics of a treatment, people tend to buy into it more.
Gotcha.
You give someone a white sugar pill that's in a gel cap unlabeled, they won't get as good of a placebo effect unless you make a big deal about taking it out of a fancy labeled package and make it a colored pill rather than just being regular, right? So any of those non-treatment effects that you can have are a good treatment effect. They are an effect. Even though it's a non-treatment effect, it is an effect. So the unfortunate part about it in this particular case is that when you're doing fire cupping, there is a risk of burning things because fire does that indiscriminately.
Yeah, it makes your malpractice insurance go out the roof.
It does.
Too, so
Absolutely. So, we put a little bit of lubrication on her. So you can also do things like move the cups around. So they're stuck on pretty good.
Well, that's what I was going to ask you. Like, what if you have lotion on, or what if you have very, like, some of our older clients are very crepey skin? Do you have to worry about?
Yeah. So if you put on cups just a little bit, just squeeze them a bit, they're very easy to pop off because they're very light. If you put it on and squish it flat and take it off, I have to work pretty hard to pull it off. Okay. If my patient is older, has that crepey style skin, I'm going to just put it on very lightly and I'm going to move it like this as I move it across their skin. And the reason for that, I don't want to just take it and drag it. That's going to be hard on them. You've got to work with the patient in front of you.
Okay.
So people should be taught how to do this by their therapist, or like how could they learn it from like your online stuff? Are there any negative effects that can happen from it? Is there, apart from the bruising, is there anything that you would say, be careful, don't do this? Like if they have like they're on blood thinners or any other things that you would say, don't do this?
Thanks for going there, because that's where I was going to go too. So yeah, absolutely.
I know, yeah, because you start thinking about like,
there are reasons why you don't want to apply cupping. So, and it usually comes down to a lack of research. So you don't do it because there is a possibility of risk, and no one's ever done the research to tell you if that risk is true or not, right? And by example, when I was a child of massage therapy, in my 25 years ago, in school they told us never do massage on a patient with cancer. Now they tell you do massage on that patient, it'll help them. And the difference is that the people did research on that to see if the supposed the theories of negative events were actually true. They weren't. So in cupping, unfortunately, there isn't been a ton of research into the adverse events end of it. So the contraindications are pretty much what you're taught in school. And those contraindications are, don't treat anyone who has cancer. Don't treat anyone who has broken skin or skin lesions of any kind, So don't treat patients who are on anticoagulants.
Pregnant women?
Pregnant women are fine. Pregnant women are really interesting. There's a whole lot of fear around doing anything.
They are.
Well, they are, right? But there's a whole lot of fear around doing a lot of things for pregnant women. And really, when it comes down to it, are you going to get any clinical advantage by doing cupping on a pregnant woman's abdomen? No. It's a big fluid-filled sac, really, with some tissue over top of it, ultimately. So don't treat it. You don't need to. It's already stressed enough.
I treat, a lot of my clients are pregnant women. I specialize in prenatal massage, and almost every single one of them get cupping.
Yeah.
And I just do it mid-back up, usually.
The first trimester, I heard that you shouldn't get massage. Do you do massage in the first trimester too, and cupping? Okay.
Yes.
That has been around since everyone got really litigious in the U.S. It's an interesting thing, and I really think it's more of a business risk of harm than it is an actual risk of harm. The concept of if a woman is pregnant, firstly, some people in the first trimester never know they're pregnant. Mm-hmm. And they have gotten massaged the entire time and been just fine.
They've probably been drinking and doing a lot of other stuff the whole time, and it's
right. So Again, when I went to school, there was this idea of you don't treat someone in the first trimester, but really about 15 years ago, that started to go away because people were treating women in, like, pregnancy is not a medical condition, it's a human condition.
I think we all, as business owners, we're always looking at least I am always going, what's the risk, what's the benefit, and if there's any kind of like risk of me getting sued for some reason that there isn't even whatever, which I think is kind of what you're saying, is like, you know what I mean? So
yeah. But it comes back to, how do you assess your patient? How do you assess the person in front of you? Is there a reason to do this treatment? That's what is important in pregnancy.
So we are almost out of time. Are there things that we haven't covered that you really want people to know? I want to give you a chance to say anything that you want to cover.
Sure. Yeah. I guess the biggest thing is, people ask, where do you get the cups? So you can buy them cuppingcanada.com or cuppinginternational.com. We sell them online. We also have education online for practitioners. We haven't done it other than the free Monday 2 p.m. Eastern Standard Time free Facebook Live talks
for the public,
for the general public.
And they're
That's
still on our page, so they can always go to our Facebook page, Cupping Canada Inc. They'll see all the videos. We do a lot of, this is how you put this type of cup on. You just place it on the skin and push down. And
you don't have to be a therapist. You can buy them straight from there and look at the educational materials and do it yourself, like figure it out. Are there like YouTube videos on how to do this?
There are tons.
Okay. Yeah, and we'll be putting all of the information that you guys sent to us, the way we've been we would appreciate it, obviously, if you circulate this to your base.
Absolutely.
But we will also be putting all of that information that you sent to us. And if there's any additional information that you want, we put it in our YouTube link, we put it on our Facebook thing, it's circulated to our, I don't know. I think we're
flowing, huh?
Yeah, I mean, I think we're at about 40,000 right now in distribution between all of our groups that we've been with. So we appreciate if you guys do that with us too. And we'll put all your contact information on there. And truthfully, like the more we can all be humanity for each other and do the right thing for each other, we'll all be fine.
Yeah, we do have a discount code for anybody that watches the video and they want to buy cups. If they go to either website Paul mentioned, cuppinginternational.com or cuppingcanada.com, all capital letters. At the checkout, you'll enter in the code Muse, M-U-S-E, Medi, M-E-D-I, Spa, one word.
And you get 10% off. I was like, oh, you guys are awesome. I didn't even ask for that. So that will be on our thing too. But thank you. We appreciate you doing that.
Thanks for having us.
Is there a limit on that, or is it just if anybody's? I mean, obviously they'll get it from our YouTube thing, but is there a time frame on that?
They want. Anytime. Okay. Yep.
See, you guys are awesome.
We try.
Anybody else?
Thank you. That was very good.
Great.
Good. Yeah, and if you have questions for us, just send them through our email is probably best.
Okay.
info@cuppingcanada.com.
Okay. We will do that. And tomorrow we're supposed to be talking about nutrition. Our guests might be changing a little bit. I've got some new information, but we'll get that out there to everybody. But tomorrow is Tasty Nutritional Thursdays. So
lovely.
3 o'clock Eastern.
All right. Thanks, guys.
All right. Thank you guys. That was awesome. Really appreciate it.
Nice talking with you.
Okay.
Have a good day.
Bye-bye.